Hundreds of bush doctors have attended the Rural Doctors Association of Queensland annual conference on the Gold Coast, discussing boosting doctor numbers and the need for an urgent overhaul of Queensland's medical workforce model. Joining me live now for more on this is RDAQ President Dr. Raymond Lewandowski. Thank you for your time, Doctor. What are some of the key topics that have arisen from the past 3 days of the conference?
Yeah, Anna, thank you for having me. We talked about how to deliver care. Right now, there's a huge inequity of care to patients in the bush, and particularly in first world peoples and in peoples with disability. And we know that the cornerstone for delivering that care is good primary care. But we're having difficulty both in the workforce, getting people to the locations where we need them, and also in how they're funded. It's a really complex system where the state and federal government are both responsible for some of the funding, and doctors often describe it as working in a straitjacket trying to treat patients. And unfortunately, what we see is that the patients suffer with an inequity in health outcomes.
You did mention the state and federal government involvement. What political support have you seen throughout this conference? What health ministers have attended and what have they had to say?
Yeah, listen, so we actually try to be positive and constructive, and we called our conference Bold Dreams and Bright Futures because we do have lots of ways to fix it. And in fact, the government is listening. Now, we had attendance from Ros Bates, the Shadow Minister for Health, as well as Yvette Dath, the Minister for Health. We had the National Rural Health Commissioner. Christian Rowan was also there, a member of Parliament, and they're quite keen to listen and to understand our position, and I feel like to work with us going forward on solving the issues of getting equitable care to patients in the bush.
So if we talk, I suppose, about issues we're seeing at the moment, COVID primarily being one, we've heard a lot about the rollout of the vaccine here in the southeast corner, but what's happening across Queensland when it comes to the take-up of the vaccine in these more regional communities?
Yeah, we discussed that, and we were fortunate that Jeanette Young, the Chief Health Officer, also was able to join us, and we had a lot of discussions about the uptake and the new Delta strain, and the critical importance of vaccination. Queensland Health and the federal government through the PHNs and our GP heroes in the bush are really working hard to get the vaccine. We can't stress enough the importance of patients' uptake, and I think that's the big message, is that we will make the vaccine available. Please get the vaccine.
Are people in the bush not keen to get the vaccine, or is it too early to say?
Yeah, I think there are a number of barriers. Certainly there's some trepidation, I think, on some people's behalf. There's confusion because of the changes in the vaccine. And then there has been some issues with availability and access. But those, I think, are clearing up. There's very clear direction on which vaccines are appropriate and the safety of the vaccines. If the patients will talk to their local GPs, they can get outstanding advice, get the correct vaccine, and be protected before they have an opportunity to be infected.
And away from COVID, I understand that a rural doctor shortage, and you mentioned it briefly before, is a big issue. But what sort of impact then does that have on these communities? I guess what's the real world impact when there is a doctor or a GP shortage?
Yeah, well, we know just from data, the farther out you are from the southeast corner, the fewer doctors there are per capita, and the lower the life expectancy. So we actually see health outcomes are worse when there aren't any GPs present. And so we really need to get the workforce from the southeast corner and from training into the bush. And it's a wonderful, rewarding career, and we just need to get the young students and training doctors to have an opportunity to experience that career and see what the opportunities are. And then we need to work with the government to remove that straitjacket of trying to figure out how to work with federal and state in that mix.
Do you have a specific number or a timeline that you would want to see a certain amount of doctors added to the workforce in Queensland by?
Yesterday is our timeline. The people deserve good health, and they deserve good health care with outcomes, and they deserve it right now. So we actually don't have these long lead-ins. We really have a crisis now, and programs that we're starting and advocating for, we're happy for them to start right now. So no, we're not looking to the future. We are looking to the future. We are optimistic about it, but we don't really want to put off solving the problems for years.
Of course, and just finally, Doctor, with this particular meeting, this conference, it's a good chance, I suppose, for doctors to come together. Does it help sort of, I suppose, what's the outcome of when you all can come together like this?
Yeah, no, it's wonderful. So the rural medicine is like one big family, but unfortunately we're quite a dispersed family, and we get rare opportunities to come together. So one of the things it does is it certainly lifts the spirits, and we come out with pretty strong momentum. We get to talk to the politicians, we get to make plans together and proposals, but we also get to reunite with our family, which helps with some of that sense sometimes of social isolation you get from being in the bush. So it's a wonderful opportunity, and that's one of the most exciting things for me.
That's great. Well, look, I do hope that you work towards those outcomes that you do want. As we know, medical care is very important in the bush and everywhere else, of course. So, Dr. Lewandowski, thank you so much for your time.
Thank you, Anna.